Hello everyone, welcome back to my channel. And today we are going to start a new topic, that is brachial plexus. And this is one of the most important question asked in your university exams from your upper limb. And it is also a very interesting topic and also a difficult topic if you are not understanding it and if you are just memorizing the names, and it becomes so cumbersome to memorize all these names and names of so many nerves there. So we will learn it by certain mnemonics I have made and my teachers told me about them. So let's start with the topic of brachial plexus. So the first question is that what is the meaning of plexus? Plexus is basically a network, and in the brachial plexus we can break this word brachial and plexus. Brachial means related to your neck, and plexus is something related to your network. So brachial plexus, it is the network of nerve or plexus of nerve which is situated in your neck. So it is basically the plexus of nerves in your neck. The next thing is it is formed of ventral rami of spinal nerves. Your spinal nerves has two rami, ventral rami and dorsal rami. So your brachial plexus is formed by the ventral rami of your spinal nerves. Okay, so which spinal nerves are involved in your brachial plexus? So spinal nerve C5, C6, C7, C8 and your T1. That means some cervical and one thoracic spinal nerve is involved in the formation of your brachial plexus. So this is the overview of your brachial plexus, and let's move to the components of brachial plexus. Okay, what are the components of brachial plexus? You can see that I have written that roots, trunk, division and cords. And the important thing here to notice is that I have put like arrows here. What is this arrow? This is basically the sequence of components. Okay, and I have written branches also here. Okay, so let's discuss. In the components of brachial plexus, first there is roots, the next is trunk, next is division, and last one is your cords. Okay, and you can remember this with the help of a mnemonic, that is real teacher drinks cold beer. R means roots, T means trunk, divisions, drink division, and C cords, and B your branches. So you can see that I have written branches like from here to here. What does this indicates? It indicates that branches can be originating from your cords or from your roots or from your trunk, but not from your divisions. Okay, so branches can be originating from your roots, trunks or your cords. Okay, so this is why I have written branches separately from all the four components. So this is the mnemonic to remember it and keep this in your mind. We will understand with the help of this diagram. This is your C5 and C6. C5 and C6 join to form your trunk. C8 and C1 join to form one trunk, and C7 continues as a single trunk. Okay, so C5 and C6 form your upper trunk, and C8 and T1 form your lower trunk, and your C7 forms your middle trunk. Okay, the next component is your division. Real, your root, and then your trunk, teacher. Next is your division. Division is basically originating from your trunk, and each trunk is giving rise to anterior and posterior division. Anterior, posterior, anterior, posterior, anterior and posterior. So each trunk is giving rise to anterior and posterior division. So this is your real teacher trunk, root, trunk and division. Okay, the next thing is real teacher trunk, cold, drink cold, cord. So there are your three cords. Okay, basically lateral cord, medial cord and your posterior cord. All the posterior divisions of three trunk joins together. Posterior division join together to form your posterior trunk. Okay, posterior division join to form your posterior cord. The anterior division of your upper and your middle joins to form your lateral cord, and your anterior division of your lower trunk continues as your medial cord. Okay, clear? Medial cord. So let's recap this diagram. what I've drawn is your C5, C6, C7, C8, T1. These are your roots. Next one is your trunk. Three trunks: upper trunk, middle trunk, and lower trunk. Each trunk is giving rise to two division, that is anterior division and your posterior division. Anterior division and your posterior division. This is your anterior, 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 and this one here posterior, posterior, posterior. And the posterior division of all the roots joins to form your posterior cord, and the anterior division of upper and middle joins to form lateral cord, and the anterior division of your lower trunk continues as a medial cord. So this is the diagram you have to draw in your exams of brachial plexus. It is a simplified diagram. So let's discuss branches. Okay, I have discussed the basic components about the roots. Here you can see like C5 to T1, the roots involved from the ventral rami of the spinal nerve we have discussed. The trunks are three: upper, middle, and lower trunk, which are formed by C5 to T1. And your divisions, two divisions from each trunk: anterior and posterior cords, lateral, medial, and posterior, three cords. And the next and important thing is about branches. So there are so many branches which are originating from your brachial plexus, and it is very difficult to memorize each branch from brachial plexus. So we have some mnemonics for them also, and it is easy if you are remembering them with the mnemonics. So let's start from the roots. As I have told you earlier that roots can be arising from your branches can be arising from your roots, your trunk, your cords, but not from your division. So let's start with the roots. So roots are basically giving rise to only two branches. Okay, one is your long thoracic nerve or nerve to serratus anterior. These all nerves I will show you later in your diagram. Okay, so first nerve is long thoracic nerve and nerve to serratus anterior. You have to remember it. Next is your dorsal scapular nerve. This you have to remember. And the root values, these are not so important here. Okay, here you can see dorsal scapular nerve. Dorsal scapular nerve, which is originating from your root, and you can see like C5, it is going like this, and dorsal scapular nerve is coming from it. So the root value is C5. The next is your long thoracic nerve. Long thoracic nerve, you can see C5, C6, C7, C5, C6, C7. These all join and form long thoracic nerve. Okay, so this is your long thoracic nerve and dorsal scapular nerve from your roots. Next is your from your trunk. As I have told you, three trunks: upper, middle, and your lower. So basically branches are only arising from your upper trunk. Okay, so two branches are arising from your upper trunk. You can see the names suprascapular nerve and your nerve to subclavius. Let's show in the diagram. This is your suprascapular nerve, and this is your nerve to subclavius. Subclavius is your muscle. So nerve to subclavius is your one nerve, and suprascapular nerve is your other nerve. And you can see like C5 and C6 are forming the upper trunk. So the root value of suprascapular and nerve to subclavius is C5 and C6 only. No need to by heart. Okay. Next and important thing is from cords. What are the branches of brachial plexus from the cords? We have already discussed there are three cords: lateral, medial, and posterior. And it is very difficult to learn the names of branches arising from each cord. So let's start one by one. Okay, as you can see here that I have written from cords, three cords. Okay, lateral cord has three branches, medial cord has five, and posterior cord has five branches. Okay, let's move to the lateral cord. Okay, lateral cord, there is a easy mnemonic you can learn: LML. There was a scooter from the name of LML. L stands for lateral pectoral nerve. You have to memorize the name of the nerve. Next, M is your musculocutaneous nerve, and last L is stand for lateral root of median nerve. Okay, there is a median nerve which has lateral root and medial root. Okay, lateral root and medial root, and the lateral root of that median nerve is arising from your lateral cord. And you can see that medial root is arising from your medial cord. Okay, so LML, three nerves from your lateral cord. Next is your medial cord. Okay, medial cord is giving rise to five nerves. Okay, so the mnemonic is M4U. There was a channel for songs B4U something, B4U. You can remember it from M4U. Okay, M means 4M and 1U. What are the 4 M's? Medial pectoral nerve, medial root of median nerve, median cutaneous nerve of arm, medial cutaneous nerve of forearm. You can see here it is forearm and it is arm. and last one is your important ulnar nerve. And the important thing about ulnar nerve is the root value here. Okay, you need to remember the root value of the ulnar nerve here. So let's recap. Medial pectoral nerve, medial root of median nerve. As I have told you that there is a lateral root of median nerve and there is a medial root of median nerve. So median nerve has two roots, lateral root and medial root. Lateral root is from your lateral cord and medial root is from your medial cord. Clear? And there are two cutaneous nerve, medial cutaneous nerve of arm and medial cutaneous nerve of forearm, and last one is your ulnar nerve. So these are your branches from your medial cord. Last one is a posterior cord, and the mnemonic for posterior cord is ulnar. Okay, so don't confuse that. Here we have studied that ulnar nerve, and there is a mnemonic called ulnar. So ulnar is not a part of posterior cord. It is not a branch of posterior cord. It's just a mnemonic called ulnar. So let's start. What is ulnar? U in ulnar is upper subscapular nerve. Okay. L is lower subscapular nerve. You can easily remember one is upper, one is lower subscapular nerve. Next is your nerve to latissimus dorsi. N stand for nerve to latissimus dorsi. Latissimus dorsi is a muscle. So nerve supplying it is known as nerve to latissimus dorsi, which is also known as thoracodorsal nerve. And next is your important nerve, axillary nerve and your radial nerve. These two are important nerves, and you have to remember their root values. Axillary nerve having root values C5 and C6, and the important thing about radial nerve is that it has it contains all the roots comprising a brachial plexus. Like brachial plexus contains C5, C6, C7, C8, T1. So is your radial nerve. Radial nerve contains C5, C6, C7, C8, T1. It contains the fibers from all the cords of brachial plexus. So this is your radial nerve. So let's recap what we have studied in the form of this diagram. Okay, so this diagram is basically taken from the Vishram Singh, and you can see these are your roots C5, C6, C7, C8 and T1, and these roots are uniting to form trunk, upper trunk, middle trunk and lower trunk, and these trunks are giving rising to anterior and posterior division, and these are your divisions with the dots, and these divisions are joining to form your cords, and there are three cords. You can see lateral cord, and this is your medial cord, this is your posterior cord. Okay, so lateral cord is giving rising give rising to three nerves L, M, L, and posterior is giving rise to 5, and your medial is also giving rise to 5. So these 5 from the medial, these 4 and this one ulnar. Okay, so M, 4, and this is your U, and these nerves are from a medial cord, and from a posterior cord 1, 2, 3 and 4 and 5, upper, lower, and nerve to latissimus dorsi, and this is your axillary and this is your radial nerve. These are from a posterior cord, and from your lateral cord it is L, M, L, 1 L, M and L. Okay, so these are the branches from your brachial plexus, and this is what we have to study in the brachial plexus. So brachial plexus is a very easy topic if you are understanding it with the mnemonics. So just try to memorize the things with these mnemonics which I have told you. This is about brachial plexus. So let's conclude this video. Thank you for watching, and please subscribe this channel. And if you want the notes, these notes, and then you can tell in the comments. Okay, thank you for watching.